Okay, so we're going to talk about the nursing process of wound care. We're going to talk about assessment, diagnosis, planning, and implementation. So assessment, we have to document the location and the appearance of the wound daily. Of course, we don't always see the wound. Sometimes dressings are only changed every 3 days, but we always know the location. So you at least need to be documenting the location of the wound. And then the appearance only on times that you see it. You never document what someone else saw or documented. You only document what you saw. So during wound care, you need to look at the amount of drainage on the wound. Is it scant, small, moderate, or large? And the color of the drainage. Again, serous sanguineous, or serous sanguineous, or purulent. Okay, and then we also have to assess the base of the bed of the wound. Color of the tissue. Is it granulation tissue? Is it slough? Is it necrotic tissue? What's the size of the wound? What type of drainage is coming from the wound? Is there any swelling of the surrounding tissue? Is there an odor? Does the patient complain of pain? What is the approximation or the degree of closure of the wound edges? Is there any warmth or edema? You measure the length, width, and depth. You use a ruler or disposable paper wound ruler. One of the best ways to measure the depth is you get a Q-tip and you advance the Q-tip in at the deepest part, and then you kind of move your fingers down to the edge of the Q-tip where you're at the skin level, and then you can pull it out and then you can measure the Q-tip, and that's how you know how deep a wound is. It's very important, especially if you have a sinus tract. You always measure the width and length at the widest point, and then we always talked about using that sterile cotton tips. So why is it important to measure wounds? Well, that's how we know if they're getting better or worse. And it's also very important that you don't document a wound that you did not measure. So don't guess what size it is. Don't put what someone else said the size of it was. The only time that you need to document wound measurements is if you actually got out a ruler and measured the wound. Where can you find rulers? Rulers are in the supply room. You can also find them on the edges of a lot of gauze wrap. The paper that's around the dressings will oftentimes have rulers on them. So it's very important that you're measuring wounds. Don't ever guess. Don't ever put someone else's measurements on there, because if you documented that a wound was 11 by 7, and that was just your guess, and someone came in with an actual ruler, and it was actually a 13 by 6, it looks like that wound's getting worse. So it's very important that you only document what you actually measure with a ruler. Nursing diagnosis: risk for impaired skin integrity because their tissue is broken. Risk for infection because they are at a risk for infection if they have a wound. Acute pain, activity intolerance, either because of the pain caused by the wound or maybe because of where the wound is at. If it's on their abdomen or if it's on the bottom of their foot, they might not be able to do a lot of activity. Disturbed body image, deficient knowledge related to maybe how they got the wound or how they're going to be taking care of the wound at home. And then anxiety, maybe anxiety related to how long they're going to have this wound. What's their life going to look like with this wound? They might have to come in on a regular basis to have wound care done. A lot of anxiety goes along with wounds. Planning. So we're going to go change a patient's dressing. Well, how are we going to do that? Well, we have to have an order to change a dressing. We follow the MD order about a dressing change. Well, as a nurse, what if we think that dressing needs to be changed? Well, if we don't have an order, we're not going to change it, but we can always reinforce it. That means we can apply more tape, we can apply more dressings on top of it, but we don't ever just go and change a dressing. If you have a specific order not to change a dressing and there's a lot of drainage around it and you're concerned about it, again, you're going to draw a circle or you're going to outline the drainage with a pen around the drainage on the dressing. You're going to put your date, time, and initials. If it's a large amount of drainage, make sure you're reinforcing the dressing and notifying the physician. Implementation: the dressing change can be sterile or non-sterile. There's a dressing change on skill 38.1. We are going to be doing this next week in lab. So on November 2nd, we're going to be doing dressing changes. You need to make sure that you're bringing your gauze dressings and your ABD pads so we can practice dressing changes up in the lab. So to change the dressing, we're going to check the order. We're going to evaluate the patient. Is the patient in pain? If so, do we need to give them some pain meds before we do a dressing change? Gather all of our supplies. We need our dressing. We need our cleaning solution. We need our tape. We need gloves. You're going to wash your hands, put on clean gloves. You're going to remove the old dressing. Loosen the tape and then pull the tape and the dressing off towards the wound. If the dressing tries to stick to the wound, make sure that you wet it with normal saline. You do not want to pull off a dressing from a wound. You want to, because then you're pulling off healthy tissue. Make sure that that dressing is moist, that it's wet, that you're not just ripping it off. And assess the drainage on the dressing. What color is it? How much is it? Because those are things that you're going to be documenting. And then you're going to inspect the wound. All those things that we talked about in assessment of a wound, that's what you're going to put here, and we're going to document those things. What percentage of the wound is granulation tissue? What percentage of the wound is slough? What percentage of the wound is necrotic? What are the measurements of the wound? Are there any sinus tracts to the wound? To do all that, we're going to remove our dirty gloves and wash hands, and then we're going to set up our sterile field. And then we're going to clean the wound. It can be cleaned with normal saline or with wound cleaner. Never clean it with cold solution. That causes vasoconstriction, and again, vasoconstriction causes a wound not to heal. Cleaning a wound incorrectly can cause an infection. You may push bacteria from the skin into the wound, so make sure you're cleaning the wound. So how do you clean a wound? Well, see your book on step 7. There's some great pictures in there about how you clean a wound. Remember, the top part of the wound is considered the cleanest. The bottom part's the dirtiest, so we're always going to start at the top and go down. So look at those pictures in your book, because those are some great pictures, and it really explains a good job about how you clean that wound. Again, we're going to be practicing this in lab. So next, we're going to apply any ointments or medications that are prescribed, and then apply the dressing. Once we put the dressing down on the wound, we don't want to remove it or move it at all, because we might be moving bacteria around. And then we take off our gloves, apply any tape or holder that we need to secure the dressing, clean up, wash our hands, and then document. Irrigating wounds. Sometimes the doctor orders for a wound to be irrigated. Maybe it has a lot of drainage, maybe there's a lot of debris in it, and so we're going to have to irrigate it. Irrigating just means flushing out an area with liquid. It's used for open wounds. Again, a physician has to order it, and it is a sterile technique. This is skill 38-2. You may want to put on PPE for this. As you see here, she's got a gown, she's got a mask, she has goggles on, because sometimes you could get some spray back from this, so you want to make sure that you are protected. You get a large syringe, either a 30 to 60 ml syringe with a 20 gauge needle. Spray the wound with the irrigation solution. It's usually normal saline. Hold the needle 1 inch away from the wound and go back and forth in a back and forth motion. You can also use a bulb. You see here, that's what she's doing. She's spraying the solution and going back and forth, back and forth. There's also a basin under it to help collect any drainage. You see, she also has it really well padded, so that way you're not making a mess all over your patient's bed. So packing a wound. This is to facilitate a wound healing from the inside out. It's also to help granulation tissue grow. It is a wet to damp dressing, which is skill 38-3. Moist gauze is placed in the wound and changed out before. So this is a type of wound that's going to be packed, and you can see here he's using gauze and a Q-tip to pack that open wound. You want to make sure that you pack it all the way to the surface, and you can see here, see why you've got to use a Q-tip to make sure there's not any sinus tracts in there. You don't know what's back there. Is that all that's there, or does it go back under the patient's skin? So it's very important that you use a Q-tip to check for any tracts on wounds that look like this. So you might use saline-soaked gauze to pack a wound. You might use this type of gauze. Again, these are normally antibiotic-soaked gauze. It's called iodoform, is a brand name of it. So you may be using this, and a lot of times you only use this for small wounds. For a wound that's this size, you're probably going to use gauze. Again, gauze soaked in saline. It's also very important to keep this wound moist. You do not want it to dry out, so this is going to require frequent dressing changes. How often? Just depends on the patient. Sometimes it's 3 times a day, sometimes it's more than that. It's whatever it takes not to let this wound get dry. You want to keep it moist. Again, sterile procedure, skill 38.3 for a wet to damp dressing. You need to review the skills for lab practice. This is what we're going to be practicing on November 2nd in lab. Always document about wounds. It's very important. The amount, the color of the drainage on the old dressing, the length, width, and diameter and depth, the color of the wound, the appearance of the surrounding tissue, and the type of dressing applied. The whole point is so we can know as healthcare providers, is the wound getting smaller? Patient education. What do you think the patient needs to know? Well, the patient needs to know how they got the wound, if it's a pressure ulcer, if it's a venous stasis ulcer, what type of dressings need to be done at home, what type of follow-up they need to have, how they can prevent any further injuries like this, and they might need to know a step-by-step process of how to do a dressing change. If a patient's going to have to go home packing a wound, they need to know how to do that. So as nurses, we're going to have to educate them on packing or doing their wound terms. Erythema is redness. Granulation tissue is red, healthy tissue. Platelet aggregation is clotting. Serous is that yellowish fluid. Serous sanguinous is that pinkish color. Sanguinous is red. Purulent is pus-filled fluid. Exudate is just drainage. Necrosis is black, dead tissue. That is the end of this, but we got to. Which phase of healing begins on the 3rd or 4th day after injury and lasts 2 to 3 weeks? It is the proliferation phase. Okay, inflammatory phase means that it's just started, so that doesn't start the 3rd or 4th day. That's actually the first phase, not the second phase. So you're looking for the second. Which of the following is not a factor in wound healing? Age, medication, lifestyle, or type of wound? The answer is type of wound. That is not a factor in wound healing because all wounds can heal and they all go through the same healing process. But again, elderly people do not heal as well. Medications, if someone's on a corticosteroid or immunosuppressant, that's going to play a factor in it. And lifestyle, if someone smokes, they're going to have problems with wound healing. Okay, hope this makes sense. If you have any questions, I will see you on lab before we have our test. And we're going to move on to enteral feeding. So that one will be coming up shortly. Look for another recording on enteral feedings. Wound care, there's that ATI website.